Hello and welcome to this episode of Hampton Roads Business Live. My name is Rory Graham and I'm your host, and today we have the pleasure of having with us Dr. Troy Morgan from Morgan Vision Care. Welcome.
Thank you. Thanks for having me.
Good. Give us an overview of what is Morgan Vision Care.
Morgan Vision Care, I started November 10th of 2009. I'm an eye doctor and I provide eye care for everyone, and I have a commitment to excellence serving your vision care needs.
Okay, well, the vision is awful important.
Yes, it is. Yes.
That's for sure. So you're located where?
Bremen Farm Shopping Center on the corner of South Plaza Trail and Princess Anne, between the Petco and the Harris Teeter in Virginia Beach, Virginia.
Between the Petco and the Harris Teeter.
Best way to describe it, so people see it, they know.
All right. Okay. Good. You get them coming and going there.
Absolutely. Absolutely.
Okay. All right. And where did you attend school?
I've attended a couple of schools. I'm locally. I went to Kellam High School, graduated the class of '96. I also went to Virginia Commonwealth University, graduated in 2000, took a year off, and I graduated from Pennsylvania College of Optometry, now known as Salus University, and so I'm in the class of 2005.
All right. So in your practice, do you deal with just people, all types of vision care, or is it just glasses, or kind of give me an overview of some of the services that you provide?
Primary care, normally, we do eye exams, contact lenses, and contact lens trainings. We also provide LASIK consults, as well as co-management for cataract surgeries. Some of the things that people really like about our practice is the fact that you don't have to be dilated, so you're able to drive home safely without being dilated. We can take a picture of the back of the eye without dilating you.
Huh.
And no puff of air either.
No puff.
No puff of air test.
Okay. All right. So what inspired you to do this?
I actually fell into it. I was in VCU and I was a pre-med major, and I thought I was going to be an orthopedic surgeon. However, I had an opportunity to go to Case Western University for a summer enrichment program, and that's when I discovered I don't like hospitals. That was just not my setting at all.
Not good to be an orthopedic surgeon.
Absolutely.
Like
so I had to have a change of.
They won't let you do that at home.
I tried. I politic for it, but it just wasn't going to happen. It wasn't going to happen.
Well, but you like what you do.
Yes, it's part of the healthcare field. I'm in a setting that's very relaxed, and I get to do. To interact with people and just get to learn a lot about people. I learn more from them. They probably learn from me.
Okay. All right. And so let's talk about some advice that you might have. What about people with children? About what age do they need to start maybe having a yearly exam?
I would say for children, I always recommend it starting around 4 or 5 when they're able to learn their letters and understand that. And because kids, they grow so much, they can have vision changes when they have those growth spurts.
Okay. And is there a favorite part of this business that you like? That's not on the list. I just thought I would ask.
The interaction with people. I learned about so many different things. I guess if I was on Jeopardy, I could answer a few more questions because I learned so many odd tidbits about all kinds of things from people. They just share with me throughout the exam.
Well, you mentioned relaxed. I guess your vision care kind of falls into. I know I talked to a plastic surgeon one time, and he wasn't doing reconstruction plastic surgery. He was doing cosmetic.
Okay.
So cosmetic, you're dealing with healthy people.
Yes.
You're dealing with people who are doing it by choice.
Yes.
And also it's a different type of surgery. But is your vision care kind of along those lines? It's not usually critical.
No, right. And they enjoy the experience of picking out the glasses. Unfortunately, I don't help them with that part, but I have people that can help them do that.
So you sell glasses too?
Absolutely.
Glasses?
Absolutely.
Okay.
Frames, all kinds of things that look good on them.
Yeah. You have people play jokes on you?
All the time.
Do you? Well,
all the time.
I did my last eye exam. A lady came. The doctor didn't come in, but a lady came in to do the eye thing where they read the chart.
Okay.
And she said, "Okay, read the smallest line you can see." And I said, "Copyright American Optical Association, 1998."
Wow.
And she looked down at the thing.
Right.
She said, "You're
right."
No, I just made that.
Right. Right.
But yeah, I guess when you're dealing with patients that are sick and all, then
it doesn't wear on me. Absolutely.
Fun.
Absolutely.
Okay. All right, so do you have mentors that I think we had mentioned a little bit about that in our conversation beforehand. You had mentioned a little bit about that.
Yes, my parents. They always give it to me straight. As we were talking about it, the older I get, the more I realize how smart they were on me. I don't know as much. They fed, clothed me, gave me shelter, put me in position to be where I am, and I can't take that for granted at all. So I'm very, very thankful that they were there in my life.
Well, I think I got a couple of sons that
They
can
want to hear
attest
this?
to that.
Okay,
Fact. Yeah.
okay.
Yeah, I've heard more than once. I should listen to you.
Right, absolutely. I say the same thing even now, now.
So you're obviously successful. I don't want to ask you what your age is, but you
Okay.
really look young.
Well, thank you.
And so what do you attribute that success to?
I would say I'm getting more used to being comfortable, being uncomfortable, pushing the comfort zone. That's how you get to really know and truly know yourself.
Right.
That's what I do. It's never easy. It's scary, but you're getting more
Business
comfortable
is
doing
like that.
Absolutely, but I'm getting more comfortable being uncomfortable.
Right,
is the
right.
best way to say it.
Yeah, well, I always say if you're going to be in business, the highs are incredibly high and the lows are incredibly low.
Yes.
But you have to be willing to get out of your comfort zone and
Absolutely.
stay out of your comfort zone, pushing it
Yes.
all the time, because if not, you'll become complacent. And
Absolutely.
pretty soon they'll pass you right by.
Yes.
And so, all right, so in your practice, you must take all kinds of insurance?
Yes,
Okay.
we do, and the insurance are always changing. One of the more popular ones that people ask me about is TRICARE, and we do accept TRICARE, but I always recommend that people call the office, and so that we can actually verify that and can give them more detailed information on what they would need, so they know.
All right, and to make an appointment, they just call your office to set up an appointment?
Absolutely.
Okay, all right. And is there anything I haven't covered? I've covered my list. Is there anything I haven't covered that you'd like to mention?
No, I think you did an excellent job. Excellent job.
Okay.
I don't have anything else to add.
So you've been in the area since
I'm
2000?
from here, but I've been back here to start in Morgan Vision Care since 2009.
You picked a heck of a time to go into business.
Absolutely, absolutely,
And
absolutely.
you've been doing it 5 years.
Yes, yes.
Well, you must be doing something right, because
Something.
that's been a really tough time to be in business.
It is, but I figured that if you can get through the rougher part, once things turn around, which I know they will be, it'll be a well-oiled machine. That was
Right.
my game plan.
Well, that's a good game plan to have, positive thinking.
Oh yes,
And
need
along
that.
with a lot of hard work, I'm sure.
Yes.
I'm sure. So, well, I wish you a great deal of success with
Thank you
this.
so much.
And
I
so
appreciate
if
it.
you are looking for someone to take care of your eyes and would like to call or contact the Morgan Center, the contact information is at the bottom of this page, and it's also at the end of this video. And I'm sure that Dr. Morgan would be more than happy to talk with you. And he could always use another patient, I'm sure.
Absolutely.
Even though the great success you've had, I'm sure you're still taking new patients, right?
Absolutely, absolutely.
Okay, well, it's been great having you in.
Thank you so
And I
much.
wish you a great deal of success, continued success, I should say.
Thank you.
And thank you for being part of the community.
Thank you so
All
much.
right.